So good afternoon, everyone. I wanted to welcome everyone to the call. My name is April Breeden, and I am the office manager at Lafayette Square Chiropractic Center. I know additional people will be coming on the call as I'm introducing Dr. Crystal, and that's fine. We welcome you all. Today, Dr. Crystal Peairs will be presenting on how to prevent and manage your allergies naturally. I know that many of you already know Dr. Crystal, but for those who don't, she's been a chiropractor for 11 years. She's been the CEO of LSCC for a decade, and she taught at Logan College of Chiropractic for 7 years. She was also recently rated one of the top 20 chiropractors in St. Louis by OpenCare.com. Dr. Crystal suffered a debilitating car accident when she was 21 years old, and chiropractic gave her life back, and in turn, she has committed to devoting the rest of her life to serving her patients. Her expertise includes, but is not limited to, pediatrics, pregnancy, extremity adjusting, and empowering families to live healthy, and active lifestyles. So without further ado, I will ask Dr. Crystal to go ahead and lead this call for us.
Awesome. Welcome, everybody. I am so happy to be able to be here today with you to talk a little bit about allergy prevention, and what a better day to do it than on Earth Day. So happy Earth Day to all of you. Today we're going to start out talking about just generally about seasonal allergies. We're going to then talk a little bit about symptoms, traditional treatments, alternatives, and the chiropractic connection. One of the things that I want you to know is that we do have a slideshow associated with this. So what I will do is take the recording of the call today and pair it with the slideshow so that you can actually have a picture of the things that we're talking about. What we're going to do is start off with the definition of seasonal allergies. And seasonal allergies are your body's reaction to allergens, particles in your body considered foreign, that usually happen just a few times a year. A sign that your immune system is working in overtime is what that allergen is. The first time your body encounters an allergen, your plasma cells release IgE, which is an antibody specific to that allergen. The IgE attaches to the surface of your mast cells. These mast cells are found in large numbers on your surface tissues, where they help mediate inflammatory responses. And mast cells release a number of important chemical mediators, one of which is histamine. The second time your body encounters a particular allergy, it's usually within a few minutes, your mast cell becomes activated and releases a powerful cocktail of histamine, leukotrienes, and prostaglandins, which trigger the entire cascade of symptoms you associate with allergies, which are things like sneezing, runny nose, sore throat, hacking cough, itchy eyes, etc. Histamine can cause your airway to constrict, like with asthma, or cause blood vessels to become more permeable, leading to fluid leakage or hives, hence the runny nose. Leukotrienes cause hypersecretion of mucus, which you commonly experience as a runny nose or increased phlegm. Pollen is an extremely common mast cell activator, but other agents can trigger these processes as well. Mold spores, dust, airborne contaminants, dust mites, pet dander, cockroaches, environmental chemicals, cleaning products, personal care products, and foods can all cause allergic reactions. Every person is different in what he or she reacts to. And just because you haven't reacted to something in the past doesn't mean you won't react to it in the future. You can become sensitized at any point in time. So what does this have to do with our symptoms? The most common thing we turn to is a traditional treatment. And those traditional treatments tend to be dealing with medication. We're looking at antihistamines, decongestants, nasal sprays, eye drops, and allergy shots. Those are the most common. The problems with medications is that they do not treat the cause. They work temporarily. Symptoms usually return if you discontinue use, and they can have significant side effects. Alternative treatments, what's nice about them is they focus on treating the cause. It takes a multifaceted approach. It results in a greater success rate, and there tend to be less side effects. So today we're going to talk about two different things for alternative treatments. The first thing we're going to talk about is things that you can do on your own. And secondly, we're going to talk about ways other wellness-minded healthcare professionals can be of assistance for you. So when we start with things that you can do on your own, the first one is to get outside. Outdoor play provides individuals with a healthy exposure to common allergens. Studies show that exposing your children to common allergens early means they are 45% less likely to develop an allergy. However, if you're experiencing allergy-related symptoms after being outside, we want you to be sure to wash your hands and face or shower to remove that risk of continued exposure to the allergen. The next alternative treatment is eat local honey. Bees transfer regional pollens into their honey. This can help you build a natural resistance and strengthen your immune system. The good news is the recommendation is only 1 spoonful of honey per day, so that's pretty doable. Next alternative treatment is clean up the cleaning supplies. We want you to avoid dangerous volatile organic compounds, such as ammonia and bleach. And whenever we eliminate the use of these common household cleaners, we end up using more natural things which are easier for our body. We don't want to harm the nasal passages. We don't want to irritate the skin or the eyes. So things like white vinegar, baking soda, lemon, salt, essential oils, and even one thing that I found recently was Norwex cleaning cloth. What's nice about them is they have silver particles in them, and it helps to keep the kitchen surfaces clean. And the thing that's really awesome is instead of continuing to use that cloth and possibly contaminating other surfaces, within 24 hours, if you just rinse that cloth and hang it, it will be without any toxins, I'm lacking on the word. April, can you help me with that one?
It essentially self-sanitizes, is my understanding, because of the silver in it. So, all bacteria and everything are removed once it dries. Can you hear me okay,
Thank you.
Dr. Crystal?
Yeah, that's exactly it. Thank you. I was lacking the word, so I appreciate it.
No worries.
The next alternative treatment we're looking at is flushing your nasal cavity with a neti pot or a Nasopure. And what's nice about this is this strategy is widely recommended, even by the American Academy of Allergy, Asthma, and Immunology. We know that whenever you use these products, by irrigating your sinuses, you will help to flush out pollens and other irritants that have collected in that nasal passage, and it will help you to breathe a little bit easier. The next one we're going to talk about is eating healthy. 80% of your immune system is located in your gut. So avoiding processed foods, GMOs, and synthetic additives is very important because they decrease the beneficial bacteria in your gut. Genetically engineered foods, which tend to be pervasive in the American diet, have been shown to cause food allergies, ditto for various food additives. Recent research has also found that junk food increases a child's risk of asthma and allergies. So certainly avoiding such foods can, at the very least, reduce your risk. We want you to avoid pasteurized milk products. And the reason that is because they are notorious for increasing phlegm and making asthma symptoms worse. Along with eating healthy, we also want you to increase intake of animal-based omega-3s. We can't emphasize enough the importance of getting sufficient amounts of high-quality animal-based omega-3 fats in your diet. The fats DHA and EPA found in fish oil and krill oil are potent anti-inflammatories. And there are plenty of studies that talk about this and how they impact and reduce allergies during allergy season. The next one is adding fermented foods and or high-quality probiotic supplements into your diet. In a 2008 study, researchers discovered that people who took probiotics throughout allergy season had lower levels of an antibody that triggered allergy symptoms. They also had higher levels of a different antibody, which was the IgG one we talked about, thought to play a protective role against allergic reaction. So this evidence that they were giving showed specifically that we noted that when newborns were given probiotics, that it may help them to prevent childhood allergies all the way around. So we know that these fermented foods and probiotics are beneficial for the body. The next thing we're going to talk about is ways other wellness-minded healthcare professionals can be of assistance in helping you deal with allergy symptoms. The first one I want to talk about is massage therapy. And with massage therapy, we know that it helps to relieve allergy symptoms by reducing stress, increasing circulation through the body, and releasing muscle tension. Another way to look at reducing symptoms is dealing with an acupuncturist. Acupuncture treatments focus on supporting the qi, which is the life energy of the body. And they have done some research articles on acupuncture as well, and it has been proven to improve breathing problems. The only thing that it said in the research is that these acupuncture treatments needed to be performed weekly during your exposure to the allergen. They found that if you tried to do it every other week, that the acupuncture didn't work as effectively. Chiropractic care, of course, is the next alternative that I want to talk about. And we know that chiropractic can help decrease allergy symptoms. We've seen it in our practice. And the nervous system is the key associated with that. We know that with regular adjustments, we will have the body restore proper nervous system function. It will improve joint motion. We oftentimes will see decreased pain. But the big one that I thought that was the most important associated with what we're talking about today is the strengthening of the immune system. So what I know is that allergies are caused by the body's reaction to a substance, not necessarily to the substance itself. I'm going to say that again because it's kind of hard to understand. Allergies are caused by the body's reaction to a substance, not to the substance itself. And so I use an example of, imagine if you were having a beautiful Earth Day today, you're just driving down the road, and you're not in a hurry to get home, and a car cuts you off in traffic. If the sun's shining and you're listening to your favorite music, and you're not in a big hurry, you're less likely to get angry, you're less likely to get upset. And so that's talking about how your body is reacting to the substance or the experience, versus if you were in a big hurry, you were trying to get somewhere, it might be raining, this person cut you off, you almost have an accident, and then we're going to know that that's going to cause a lot more stress in your body. Other treatment in our office that we recommend is the use of tea tree oil. What we know is that tea tree oil is an antifungal, antiseptic, and antiviral. It really, really helps whenever we use it to lessen the symptoms of colds and flus. It will, if you put it in a vaporizer, help to loosen chest congestion. You can add it into your bath. It's great for helping to treat sinus infections. And so what we usually recommend with the tea tree oil is you can drop a drop or two into the palm of your hand and rub your hands together. And after you rub your hands together, you can cup them and then take a nice deep breath. And what that will do is allow that tea tree to go into the sinus passages and help to clear out any possibility for infection. The best time to do it is once you've gotten out of the shower. You can also add it into your bath water, like I said, and do the same thing whenever you get out of a bath. And the final place that I think that you can use tea tree oil is if you do use a nasal irrigation system, like a neti pot, you can actually add a drop of it into the water solution. But I always say that it's not for the faint of heart because it can burn pretty significantly, but it usually doesn't cause any major discomfort. So, April, do you want to go ahead and talk a little bit about the nutritional recommendations that we offer in our office?
Absolutely, Dr. Crystal. So for those of you who are note takers and list makers, this would be a time to maybe take some notes. We want to make all of the products that we think could help in preventing and managing your seasonal allergies available to you. So all of the things that Dr. Crystal has mentioned in the call today, we do offer at our office, and I'm going to speak to each of them briefly. The first two, of course, are just the NasoPure, the nasal irrigation system, as well as the tea tree oil. And the nasal irrigation system is about $20. It's a salt and water system. And then the tea tree oil, I think, runs under $15. I don't know the exact amount. But we have those two available. In addition, for the nutritional recommendations, we talk about core nutrition in our office. And what we mean by core nutrition is let's look at the primary things people should be getting from their diet but aren't. And we're always going to encourage you to try to improve your diet, and we have great resources in our community, including Jessica Eidelman, who I think might be on the call today with Glow Nutrition, if anybody's interested in speaking to an expert on nutrition a little more directly. But it still can be hard in our day-to-day lives to eat exactly as we should. So what we recommend for core nutrition is Juice Plus, which is basically just dehydrated fruits and vegetables. It helps us get more fruits and vegetables into our daily diet. It is cold processed, and it is all pesticide-free, and it comes in capsule form and gummy form for children. They have a great program where kids can get it for free between the ages of 4 and college age. And Juice Plus helped me tremendously with my own allergies when I first started taking it. It takes about 4 to 6 months for that effect, but it's an overall anti-inflammatory effect on your body. So Juice Plus is one product. Second product is our Nordic Natural. That's the brand that we prefer. Nordic Naturals fish oils. And they have several varieties. The one we use most commonly is the Pro Omega, and it just helps you get those important omega-3s in your diet. So other than fruits and vegetables, second biggest gap, in our opinion, in the American diet is healthy fats. We eat a lot of the wrong fats and not nearly enough of the right fats, which come in the forms of things like fish oil, avocado, walnuts. Number 3 for our core nutrition is probiotics, and we prefer a company called Mercola. They have stevia-sweetened swish sticks, for those of you who don't like to take capsules, which are kind of like a healthier version of, I forget the name of the company, but they make those flavored water sticks that you can mix with water, don't use them because they're full of chemicals. But this is completely natural probiotics mixed with a little bit of natural fruit flavors and stevia. You can take it in that form, or you can take it in capsule form. And then our last two is Allerplex. And Allerplex is great for when you're really having active allergy symptoms. For some people, it takes as few as a couple of days to work. For other people, it may take a month or two. But the product is basically an all-natural antihistamine, and it contains things like betaine hydrochloride to help with your stomach pH balance, calcium to help with immune system function, fenugreek seed, which helps to dissolve mucus and act as a solvent. It's just a really great product. 80% of our clients respond really well to Allerplex. We get about 20% that don't seem to see as much of a change. For those 20%, they tend to be people that suffer not from so much seasonal allergies, but more chronic sinus problems like sinus infections, year-long allergies like mold and house dust and pets. And for those people, there's another product called Congaplex. And Congaplex is great for drainage and immune function. So that pretty much wraps up the products. I know that was a lot. I will talk more at the end of the call, but all of these will be on sale with the exception of Juice Plus because we get it directly from the company at 10% off throughout the remainder of the month. So if you would like to purchase any, we can talk about that at the end.
Yeah, the only other big thing that I wanted to add on to the conversation today is that we know that oftentimes when we're dealing with allergies, it's a multidisciplinary approach that works best. What I've found in my experiences is it's not just a chiropractic adjustment, an acupuncture treatment, a specific supplement that you take, or any one of the other things like just getting outside that improves it. It appears that when we combine different things together, we see the fullest benefit for our relief of symptoms. So if you are already doing some of these things, I applaud you. Continue doing them. If there's something on there that you didn't think about that you might want to try to add, let us know. We would be happy to help you figure that out. Our team would also love to just sit down one-to-one with you and evaluate any of the other needs that you have associated with your allergies. We definitely want you to get the relief that you deserve. If you are not a patient in our office, we would invite you to come on in and let us check out your nervous system, see how it's functioning, and see if chiropractic could be part of the solution. So that's all that I have for today. April, if you would like to add anything else, go ahead.
Absolutely. Well, I wanted to thank you, Dr. Crystal, for continuing to teach all of us, and I wanted to thank everyone for being on the call. If, again, anyone would like to order any of the specific supplements or products that we talked about, if you're a patient in the office, you can, of course, just pick it up at your next visit. If you are not or want it sooner, you can call our office at 314-436-3050. That's 314-436-3050. And you can talk to Michelle or I, and we can help you place an order and even pay over the phone. You can pick it up. We could ship it to you, but there would be, of course, an additional charge for that. Also, for anyone who is not a patient who is on the call, we are offering for you and your loved ones. So even if you are a patient, but you have a loved one who's not in care or a coworker that's not in care, we are offering $50 off of the new patient consultation at our office. The normal cost is $125, so that would bring the initial consultation down to $75. And this is important because, as Dr. Crystal said, allergens are everywhere. Some of us react to them and some of us don't. The question is, if you're someone who reacts to it, what in your body is reacting to this natural substance in a not natural way? And I think that's where chiropractic care and the nervous system really comes in, because it is a nervous system-driven overreaction. So all of the other things we talk about, maybe with the exception of nutrition, are really symptom-based. They're designed to manage and in some cases prevent the symptoms. But chiropractic care is really designed to get at the root of the cause and see how your nervous system's functioning, and we have really unique and cool technology that helps to do that. So please, if there's someone you would like to refer to our office, or if you would like to refer yourself to our office or ask any questions, you can call the number that I mentioned before, 314-436-3050. You can also learn more about chiropractic in our office at stlchiro.com. And with that, we promised always to be respectful of your time, so I believe we're before 1 o'clock, and we are ready to wrap up the call. Dr. Crystal, if you know a way, forgive us because we are getting used to the technology, if you know a way to unmute the callers, this would be a good time to unmute everyone who would like to stay on the line and perhaps ask any questions.
I will do that. Give me 1 second. All right, so if anybody has any questions, go ahead.
No, I had one question about the fermented foods.
Is this Matt?
It is. I'm sorry. I should have announced.
No worries. Everyone, if you ask questions, introduce yourself and then go ahead with your questions. So, Matt, go right ahead.
You just mentioned that fermented foods were a good thing to add, and would that include? I mean, are you talking like things like pickles, sauerkraut, kimchi, that sort of thing, or just are you talking more about like things like yogurts?
I'm thinking more along the pickled stuff like you were talking about, the sauerkrauts and things like that, because, again, with some of the yogurts, we run into the issue that we then stimulate with the dairy, that mucus production and stuff like that. But if your body can handle that, then there is some benefit associated with those products as well. But I would say more along the other lines, the first ones that you were saying.
Gotcha.
So kombucha would be kombucha, sauerkraut, kimchi, which is, I think, like a traditional Vietnamese food or Asian food. These are all fermented type foods. Yogurt, if you're going, for those who are going to go with yogurt, I would definitely veer towards non-sugared yogurts, right? Because sugar has its own inflammatory immune issues. So you want to, go with yogurts that are plain and don't have a lot of added sugar or flavoring, certainly no artificial sweeteners.
Yeah, we know that if you're using a yogurt that already has fruit in it, that what's going to end up happening with that is that all the probiotics that are in there are not going to be beneficial because the sugar decreases their potency. So if you're going to use a yogurt, you want one that is going to be just a plain one. Good question. Does anybody else have any other questions? All right, great. Well, thank you all very much for being on the call. And if you do have any questions that you just didn't want to ask over the phone, you can go ahead and email us or call us at any time. and we'll be happy to answer those. I hope you have a wonderful Earth Day, and thank you very much for being on the call.
Thank you both. This is Tanya. Thank you, guys.
Hey, you're welcome.
Thank you. Bye-bye.
Bye-bye.